Rich today is going to talk about men's health. Men, they're probably one of the hardest people to work with because men, they usually never come to the office unless they're having some catastrophic event. They have in the ER or something like that because they had a heart attack or they had some issue that they're new diabetic, whatnot. The other reason they come in is if things downstairs stop working. That's pretty much the only reason they come in. I always joke, men will, every 3,000 miles they'll check on the car and make sure it's running fine. They hear weird noise, they'll take care of that. But I always tell them, well, if you care so much about your car, what about your body? Why don't you get checkups yearly and get blood to see what's going on? Don't wait until something bad happens before you fix it. It's just like if your tires make a noise, you don't wait till your car flies off the road because your wheel fell off. You can get it fixed beforehand. I'm just going to just talk about some of the most common things I see with men as far as issues and signs and symptoms, how we treat it and whatnot. I'm going to try to stay away from as much of the numbers and stuff. I don't. That's the first thing, the number one thing I just see, and this goes with a lot of this electrolysis. It goes. You can go with women as well too. It's good. It goes the same, but the first thing is hypertension, high blood pressure. Very, very common in the office. People typically have high blood pressure, are usually diabetics or high cholesterol as well. Some of the symptoms you may feel if you do have high blood pressure, fatigue. Some people get anxiousness at times. They feel like the pressure, or they get headaches. They get dizziness at times, but majority of people, that's typically only the blood pressure is very, very high. If you have minor elevated blood pressure, you may be asymptomatic and feel fine, have no issues at all. It's not until you come to the office like, hey, your blood pressure's high. Like, oh, I'm just anxious, or I just have white coat syndrome, or whatnot, which it may be the case, but I always try to tell patients, go home, relax, get your blood pressure reading at home, buy a machine and see where you're at, and then, come back, and if it's been running high, get treated. But some of the things high blood pressure can do, it can cause enlargement of your heart. Your heart's working hard, and under more pressure, so you can get enlarged heart muscles. It can cause kidney disease, hardening the vessels, and can cause stroke and heart attack. And the other thing is it causes damage to your vision. The eye is it's one of the only structures that we can actually, from our office, we can actually see inside your body. We can see the blood vessels and whatnot just from looking into your eye. And if somebody has high blood pressure, actually the blood vessels they'll flare out. They rupture, and you can look and see, and that can actually cause irreversible eye damage. If it goes untreated. Some of the things you can do to help with blood pressure lower, of course, there's medications if that's the case. Lower your salt in your diet, get more active. If stress is causing your blood pressure, we'll fix the stressor. If you have COPD or things like that, that can cause high blood pressure as well. Alcohol and caffeine as well can increase that. Next thing is high blood pressure, high cholesterol. You don't have to necessarily, most people think, oh, if you're overweight, you're obese, that's me of high cholesterol. But I've had some patients where it's familiar, where it's actually genetic. I have one guy, a patient of mine, he is great shape. He's a triathlon runner. He is just not an ounce of fat in this guy's body, but his cholesterol is through the roof. It's all hereditary. So the best thing we can do is you don't really have much as far as symptoms. You don't really feel much when it comes to that, but it just augments everything else. It kind of works with your high blood pressure. If you have coronary artery disease or you have diabetes, they all kind of work together to make one big issue. But some things you can do, of course, diet and exercise, and there's pills you can take. The most common is statins. They're cholesterol pills. They work amazing. They're very good. However, there is some negative connotation where they can increase your liver enzymes, but as long as you watch it, you're fine. The most common complaint I get is people complain when they have mild muscle aches. A lot of people they'll quit taking cholesterol pill because they'll have really bad pains in their legs, typically at nighttime, and you can get any muscle joint. But usually your doctor can switch it to another one. It may work. And if you try all the statins and it work, you can bump you to a different type of medicine to help control it. But honestly, the best thing to help lower cholesterol is going on a Mediterranean diet. If you do, incorporate lots of, if you're eating fresh fish at least 3 meals a week, and using olive oil and things like that, that's one of the best things to help lower your cholesterol. The next thing to talk about, the most thing we see a lot is diabetes. Type 1 diabetics, I mean, you're going to come in regardless. That's something that it's not that you'll see a doctor for that because it's so severe. Your body just completely stops making all insulin, so you need treatment. But type 2 diabetes is different. Your type 2 is when your pancreas is able to make insulin. However, your cells are kind of numb to they're desensitized. They don't, what some insulin would do to help decrease your sugars. You need more insulin to be able to work. So over time, with bad lifestyles, eating and whatnot, and genetics, you slowly your sugars rise, and your pancreas has to keep working more and more and more to keep up with the demand. And there's been a lot of there's different medicines you can use. We can use metformin is the most common medicine we use. It helps desensitize the cells so they work, so the insulin actually can get driven into the cells. But over time, when you have a person who's a type 2 diabetic and they go to pills to insulin, what happens is over time, the analogy is if say you have there's these cells in your pancreas called beta cells, and they're the ones that make the insulin. Well, if you're constantly eating, a bad diet and you're not active, they're constantly working. It's almost like having a factory with factory workers. You're making them work 24/7, 7 days a week, and they're just constantly working overtime. Well, eventually, over time, those beta cells start to die off, and that's when you have somebody who's a type 2 diabetic who goes from pills to starting to need insulin. There's been a lot of people suggest that the sooner you jump to insulin, you actually save your pancreatic function. So you're kind of taking the load off quicker. So I have a lot of patients that if I put them on, say, if their sugar is very high, I'll put them on metformin first, and I sometimes jump right to insulin. Some doctors may disagree with that, but it's a way of it's the most natural way your body, it's what it needs, so we give it to you. And the pens these days, they make now, it's so minimal as far as the needle going through anything. It's honestly easier than taking these pills that give you diarrhea and whatnot, and abdominal pains and stuff. And some of the pills, there's been a lot of questionable concerns, whether the one was lactose or bladder cancer or whatnot. So insulin, it's very, very safe. The biggest risk you worry about is your sugar getting too low, but you just got to monitor them closely. Well, of course, diabetes, what it can do to you, it can cause nerve damage, kidney disease, heart attack, stroke, vision problems, and blindness. It can cause you, it can actually lower your testosterone levels and whatnot, which I'll talk about that later, and cause sexual dysfunction. Let's see here. Next thing I see in men is skin cancer. About 2/3 of melanoma typically is with men. Things to look out for, I tell the patients, if you have any moles or anything, look for A, B, C, D. A is for asymmetry. If you were to take that mole or whatever you have and divide it in half, if one side looks different than the other side, that's a red flag that essentially you should get looked at. B is for border. If you start noticing the border is not nice and circular and it's kind of rough and irregular, that's something you should have it looked at. And C is color, any change in color. If you have a mole or something that's black here, brown here, it starts getting red, should get looked at. And D is for diameter. If you notice it's getting greatly enlarged over a period of time. Those are all warrant being looked at. I actually had a patient one time, a mother, she came in with her daughter. The daughter had some mole on her head she wanted looked at. And the mom, she was sitting there, and I knew the daughter's mole was benign, but I took it off anyway. And I was like, did you ever have it looked at in your hand? And the mom was in a chair. She said, oh yeah, I had it looked at before. The dermatologist cut it off. It was fine, no big deal. It's fine. I was like, well, you really should get that looked at again. Long story short, she got checked here. She had, it was cancerous, and she had, and luckily we caught it pretty early, but she had still to get lymph nodes removed and everything. And she would never came in if it wasn't for her daughter having some questionable mole. So it's very, even though you had something that the doctor says it looks fine, you can still keep an eye on it because things do change, and you have a lot of lesions that can be potentially pre-cancerous. So things you do: wear long sleeves, sunblock, just try to monitor your time on the sun as much, but sun is good though. Next thing is colon cancer. Colon cancer is one of the most aggressive cancers you can get, but it's the most preventable. Doing colonoscopies can greatly decrease. If you catch it early, there's a huge success rate. Because the thing is, a colonoscopy, not only is it a diagnostic procedure, they can go in and see what's going on, they can actually treat you there. If they see a polyp, They can go take it out, and that's not going to turn, it's gone. It's not going to turn to cancer potentially. They don't recommend colonoscopies until age 50. Then that's when they recommend you getting them. Then after that, depending on how it was, you can go from every 5 to 10 years, 7 years. But they find lots of polyps or whatnot, they may want to do it every year, 2 years. That is different though. However, say you were 40, or say you have a family member who has colon cancer, say they were 40 years of age or whatnot, then they recommend you get done sooner around the age that family member who had it. That way you can get checked. I had a patient one time as a husband and wife. They came in for something, I forget what they came in for, something routine, and the husband was like, "Are you going to tell him about that blood?" And she didn't want to talk about it at all, and he's like, "You need to tell him what's going on." She was having a little bit of blood in her stool, and that's one of the symptoms potentially, because colon cancer is not one you really feel. You can get some discovered stuff, but usually by then it's usually severe. But typically the most common symptom you get is dark stools or blood in your stools or whatnot. So she thought it was just a hemorrhoid or whatnot, didn't want to look at it, but we ended up, I was like, no, we really should take it seriously. I ended up sending her to the colonoscopy. Here she had colon cancer, and she had to get removed. She got 19 inches of her bowel removed. She had a rough year or two, but the thing is, he saved her life by saying it, because if she would have waited longer, it would have spread, and there's nothing you could have done. I mean, so it's just, and now she's a huge advocate for telling everybody to get screened. And a lot of people say, "Well, I don't want to do it. It's uncomfortable. What if they perforate my bowel? That's the big risk." Everybody's always scared of. I've helped do those before, and they're very easy procedures. The risk of that happening is far less than the risk of actually, getting cancer yourself. So the worst part of getting a colonoscopy is honestly a day or two before, when you're taking the stuff to help clean your bowel out. That's honestly the worst part of it all. The actual procedure is very easy. Get it out in about 20 minutes and you're done. Then you get peace of mind for how long. Next thing is for men's health is a prostate. Typically don't start checking prostate until age 50. However, just like the colon cancer, unless you have family history or whatnot. The current recommendation they do, there's a PSA test, which it's a test you do that it'll show potentially if it's elevated. But the thing is, it's not so specific for just prostate cancer. It can be elevated if you have an infection in your prostate, or if you're riding a bike for too long and an irritation there or whatnot. So, but it is a good indicator of, hey, it's up, we should get it looked at. They also recommend, doing the manual exam, which men fear, once every 2 to 4 years, which you can feel if there's any hard nodules or whatnot. But nonetheless, if you're having any symptoms, where you're having trouble urinating, where you can't get a stream out, your stream starts, coming out differently, you're trouble with erections or any pain, you should get it looked at. Prostate cancer itself, honestly, I have a fact here. What was it?
1 in 4 men will get it before they die.
Exactly. And the thing with prostate cancer, it's likely it's not. If you can get it, it's likely it's not what's going to kill you. Here it is. The lifetime risk of getting prostate cancer is 16%, but the risk of dying from it, if you're in that 16%, the risk of dying from it is only 2.9%. So it's a very, very low risk, and it's one of those things where if you catch it, it's treated. There's different hormone modulators you can put you on, or they can do surgery. But nonetheless, it's something to keep an eye out. And actually, after age 70, we don't need to check for it, because it's not even worth it. Because we have it, it's likely not going to kill you. It's so slow. The next thing is depression. This is probably one of the hardest things in family medicine as far as with men. Men, we like to think we're fine. We just deal with stress. We don't like to talk about it. And it's one of the hardest things to bring up, because, like I said, it gets so defensive. But stress itself, I'm not a big person with medications. Like, if we need it, we do need it. There's different, I'm not opposed to treating with it. But if there's something that's causing, if you don't like your job and it's causing you to be stressed, or your spouse or having issues, fix that. Fix the issue itself instead of going right to medications. But if you have done that and you're still depressed, because there is a genetic link to depression and anxiety, and there's some DNA testing you can do and find out that's the case. There is medication you can take, and a lot of people have that whole, I don't want to take it because it just makes you a zombie, or it's not natural, it's not what. Well, my analogy is this: you're depressed or have anxiety because your serotonin gets low. So what these medications do, they help they help slow the metabolism of your own body, serotonin and whatnot. And I tell people, well, if you're diabetic, if your body stopped making insulin, would you be opposed to taking insulin if you had to? No, I need it. Well, it's the same thing. We're giving you a pill to help raise your serotonin. It's the same process, it's just that negative connotation that we see today, and people don't want to, people just don't want to talk about it, just try to deal with it. But if it's affecting your life, where you're actually having bad, you're depressed, your marriage is falling apart, you're not having a good relationship with your family, whatnot, it's probably one of the best measures you can take, especially if it's affecting your blood pressure, whatnot, all that stuff. So, but there's other causes, there's other causes for depression. The big thing is potentially also hormonal. Like with men or women, low testosterone can cause it. Your thyroid's underactive. Women, if their hormones are off, especially through like menopause and whatnot, that's a huge thing you see. It's just the ups and downs and ups and downs. And so sometimes taking, hormones can actually help balance it out. But there is risk and benefits with that, so you got to kind of preach patient, tailor to them. Next thing we see a lot with men is alcohol and tobacco abuse. This is another tough one because, especially alcohol, we don't like to admit that we have a problem. And typically, if you have a person who's alcoholic with men, they get very aggressive very quick. And it's not until they hit rock bottom until when they seek help. So typically, if you have to kind of just try to figure out why you drink. Are you stressed? Is there an issue? And get to the underlying cause, because it's a crutch. Some people, whenever they have, we eat to deal with stress. Or other people, they do drugs or they drink alcohol or whatnot. So it's just, try to find out what the underlying cause and fix that. And there's different medications we can do to help, help with that. But being alcoholic, it does horrible things to your body. It causes cirrhosis to your liver, bad for your heart. So just another common thing I see in the office. Let's see here. And the next thing, which is probably one of the most things I see typically with men, is erectile dysfunction. That's one of the biggest reasons, like I said, men coming off as for actual issues. Erectile dysfunction, typically, with younger men, it's usually more of a mental thing, where more of anxiety or whatnot, that's what causes them to have that. Older men, however, usually there's some other comorbidity that is causing whether or not they have, usually the most common is diabetes. Because typically, if you're a person who has had uncontrolled blood sugar for a while, typically that is the first thing that starts to go. And then therefore, by the time they come in here for that, we start doing the work. I'm like, oh, you're diabetic, that's why you're having it. And the problem is, you may get some function back, but by then, diabetes works on all the blood vessels and everything. You're not going to get likely back to where you were. So watch things early will help you down the road as far as that, because for a man, that's the one thing they did not want to lose. So, and as far as treatment for that, say it does come from a low testosterone, you can take testosterone supplements or whatnot for that. There's different medications like Viagra, Cialis, and whatnot. As long as it's safe for your heart, you can take that. Then they also have pumps and whatnot, and implants you can do if need be. Another thing, and like I said, and then the most common complaint I get with every patient that comes in is fatigue, especially men. Men will come in when they're tired, and typically for men, first off, the most common cause is typically medication side effects. But once you rule through all that, one cause is potentially, low testosterone. I'm a big advocate for that. Not for everybody. It's to each, because there's a risk and benefits with it. But low testosterone for men is a big cause potentially for having fatigue. But not only that, it's a huge. If you have low testosterone, you can have depression, you can have irritability, you can have fatigue, weight gain, like losing muscle mass, strength, trouble sleeping at night. This is one of the things I push a lot, because I have guys that come in here, and it's easy to put them on medications and whatnot, but to fix the actual cause, you can do so much better. I had one guy who came in my office. He actually was in the house. He came in, a friend of mine. His life was a mess. He was on all these different anxiety meds. He was on Xanax and Zoloft and whatnot. He was having all these suicidal thoughts. He was at an all-time low. And here we ended up checking his testosterone levels. Just by fixing that, he was off all his medications and doing great. Now, the thing is, there's a lot of concentrated with testosterone because there's the risk of potential blood clots and strokes and whatnot, and there is that risk. However, just with women with birth control, what's the number one risk with that? Blood clots and strokes. Some signs you can look for. Typically, men, the testosterone is the highest in the morning, drops off in the evening, and that's why if it's normally men get more erections. That's when it's the highest. So by the end of the day, it drops, and that's so. If you get the blood work done, you may the range is very fluctuant. Where it's some labs is 250, 300 to 1100 is the range. So there's a huge gap there. And some providers are like, well, if you're symptomatic, you're having your sex drive, and you're depressed, and all these things, you're irritable. Your level's 400 or 301. Well, you're normal. Well, you're on that low normal range, and if that's the highest it is in the morning, it drops off. To me, I would treat that patient. Other providers probably wouldn't. I just have so many people who do well on that, and they can get them off all these other medications. Just like women go through menopause, get hormones. Women go through menopause, the same sort of thing. But like I said, I can't stress enough there is risk with that. And something your doctor has to go through the risk and benefits and make sure you're a qualified candidate for that. Other things, as far as fatigue, B12 deficiencies. B12 is a lot of people are deficient in B12. B12 is very, very hard to absorb in your gut. And I'm sure you've seen this stuff on TV with the acid reflux pills and whatnot. One of the biggest side effects of taking Nexium or Meprazole are those PPIs, as they're called. They actually decrease your mineral absorption, and B12 being one of those. And so B12, it's very important. It helps with mental acuity, helps with energy. But also, low levels of B12 will cause depression and anxiety. B12 is actually used in the pathway to help make serotonin that I talked about earlier. So if you have decrease in that, taking B12 can actually help out in many ways. Now, there is oral over-the-counter you can take, which high dose it's fine. Say if you really can't overdose on B12, but there's some people who literally you can take a ton of oral B12 and just still not do a thing to boost it. So therefore, injections. And I know a lot of my elderly patients, you put on B12 injections, they feel like $1 million. You can only give them once a week or once a month, they feel great. And it does make a big, big difference. And the other thing, kind of with that vitamin D is it's a big thing you've been hearing about lately. And it's actually, vitamin D is actually, it's technically not a vitamin if you want to look at it that way. A vitamin is something that our body doesn't make. It's what we, but we need it, so we have to get it through our diet or whatnot. A hormone is something our body makes itself. Well, vitamin D, there's vitamin D2, which you get through, through dairy products and whatnot. But vitamin D3 is what our body makes itself. So technically, it's a hormone if you look at that standard. We get D3 through sunlight. So the more you're in the sun, you start making more D3. If you look at us now, we're wearing clothes, we're working inside all the time. So I could probably count on my hands, both my hands. I have patients that come to my office to get their vitamin D levels checked, who don't take anything, who are normal. Because the range, it goes between, if you look at a lab standpoint, 30 to 100. There's such a huge space there, and the majority of patients I have are on the low end. Vitamin D deficiency will cause weak bones, osteoporosis, but there's been a lot of study, now this is nothing that we can confirm or anything yet, but there's been a lot of studies that show that potentially low levels of vitamin D are linked to depression, linked to breast cancer, colon cancer, and it's very interesting. Vitamin D actually, metformin also has a pill to help with sugar, blood sugars, lowers your blood sugars. There's some studies that show that vitamin D at high doses is just as effective at lowering your blood sugars as metformin. And actually, I had one patient, he was a diabetic on insulin and whatnot, and this is under control, and I watched his levels and everything, but his sugars were running around the 200s and whatnot. I put in a very high dose of vitamin D3 for a while. It dropped his sugars by an average about 50 in the morning. Like he went from running the 200s down to like 150, 140. And like I said, that's something I don't recommend anyone doing unless you talk to your doctor and they monitor your levels and stuff. Because your level, there is vitamin D toxicity if it gets too high. But I think you'll start seeing some more stuff here coming out because there already has been a big push, but they're doing a lot of studies with it with vitamin D. And one of the last things, and I don't know if it's a big issue, I imagine it's a big issue, is like Lyme disease. I see it a lot with men, especially because men, women are outdoors a lot too, but men to be hunters and whatnot. Lyme disease in, it was last year, I saw an article. Pennsylvania was the #1 state with Lyme disease, and where I'm from, Fulton County, was the #2 county with the highest amount of Lyme disease. Now, it's hard to say, is that because we're screening for it more than other counties, or, you know, is it just, you know, we truly do have a higher number? But regardless, I mean, Lyme disease is definitely a thing, and there's patients who come in. I can tell you some crazy stories. I'll tell you, so this is a very interesting story. This lady came in, young girl, she was a phlebotomist. She, fine, she had no issues, and out of nowhere she had this panic attack, and for 2 years she was going through all this, like, she just could not function. She actually couldn't work. She was having panic, anxiety attacks, depression. She was a mess. And I tried her on everything, and I even sent her to psychiatry, and I got to the point I was like, hey, there's nothing I can do for you. I mean, we maxed out everything. And one day, after about 2 years after this all happened, she came and said, you know, I've been really having some joint pain and whatnot. So I did my normal joint pain workup, which I do rheumatoid gout and all that stuff. And I threw in a Lyme titer. Here, Lyme disease came back positive with the one test. I put her on antibiotic for a month. All of her anxiety gone. She was off all of her cyclines instantly. And it's just, there's just story. I mean, it just creates Lyme affects every aspect of your body, your hormones, your heart, your nervous system, everything. And the problem with Lyme disease, one, it's very hard to diagnose, you know, because it's, say you got bit by a tick, you had Lyme's, you can get tested, you know, that day and be normal. Tested 2 months, be normal, 3 months normal, 5 months normal, 6 months a year, oh, you're positive. And there's a lot of, you know, there's different, doctors read the test differently as far as who treats, who they don't treat. And then on top of that, not even just Lyme disease, there's now these different co-infections, like Babesia, Borrelia, and Bartonella, that don't usually get tested, but they also are transmitted through the tick as well and can give you the same symptoms. And the thing is, if you ever do have any tick bites or whatnot, you know, if a tick's been on for less than 48 hours, you typically, there's a very low risk of transmitting getting Lyme disease. However, if it's been on for longer, you have a higher risk for it. Now, that's, you know, if it takes a long day and you do have a large bullseye or whatnot, you definitely need seen and treated. But the thing is now, you know, back in the old days, you know, you would classically always get that bullseye reaction, but now you don't need to see that. It can look like a weird red patch around it and still be positive. But Lyme disease is one of those things that's really emerging now. We're starting to, you know, we're just slowly learning about it. And there's lots of treatments, but they're not approved yet. And there's a lot of, there's different doctors have different opinions on how they treat it. I tend to be over-aggressive because, you know, I've seen what it can do to people. I think it can cause a lot of different things, and the sooner you treat it, you know, the better off you are. But so that's that. I really don't have much more, I don't think. If you guys have any questions at all, anything, feel free to.
So you were saying about the